You are with the big story here. I'm Seher Zama, and the big story continues to be coronavirus, with several more positive cases that have been reported in India. Today, we're looking at a total of 147 with 3 deaths. 10 new cases reported across the country today. This includes West Bengal recording its first case as well. But among those diagnosed, 122 are Indians, 25 are foreigners. Maharashtra continues to be the state with the maximum number of positive cases of 41. Let's in fact get in more details. This is with respect to Iran and the positive cases here that are coming in from Iran regarding Indians. Remember, there were several Indians in Iran, and now the government of India confirming there are at present 276 coronavirus infected Indians abroad, out of which 255 are in Iran. This confirmation that came in after the External Affairs Ministry was tight-lipped when asked about it yesterday, but confirmed the news in a parliamentary response today. Let's get in further details. We have with us our correspondent Ayushman with those inputs. Ayushman, these are very specific numbers now that have come in from the External Affairs Ministry here, not just Indians who have tested positive in Iran, but other affected countries such as the UAE and Italy as well. Do we have more information regarding the kind of treatment that they're getting there?
Well, sir, yesterday we asked this to the Additional Secretary Dambu Ravi when he was there in the press conferences to the list which was doing round because we had got it from the sources, and it was said that these are the people who have been infected, and as per the information which was available to the Secretary at that time, he clearly said that the truth in that cannot be verified. But today the government clearly stated on the floor of the House in Parliament when they said that 255 Indians in Iran have been found positive, and after that there are 12 Indians in UAE, and the total number of Indians affected right now who have tested positive is 276. This is the number that the government has given in the Parliament, and it has also been said, like it was stressed yesterday, that Indian embassy are there in touch with the local authorities, and these Indians are being the medical facilities are being attended by the Indian embassy in touch with the local authorities. But there is no word as to when these people can be brought back. If you remember, at the starting session of the Parliament, only the MEA, Minister of External Affairs S. Jaishankar, has said that not everyone can be brought here, only after the tests are done and the informed reports have come that all those people are not infected, only they can be brought back. Now the now the official message of the government is that 276 Indians are there abroad who have tested positive of coronavirus disease.
Ayushman, this would of course come in as a huge concern for families back home in India, because if we were looking at the two worst affected countries on this list where Indians are there tested positive, that is Iran and Italy, where it is already established that their medical infrastructure is currently hugely underburdened, not being able to treat their own citizens.
Well, sir, that is why the ministry has clearly stated in the response that the Indian authorities are looking after the medical facilities which is being provided. And not only that, they are doing in sync with, they are in touch with the local authorities, and only then the medical facility is being provided to them. And the Indian embassies are in contact with the Ministry of External Affairs on that.
Okay. Yes, Ayushman, thank you. That's undoubtedly on an assuring note here that's coming in. Thanks for giving us that input. Karnataka State Dental Council now has advised all dentists to shut clinics, follow government advisory for the general benefit of public, patients and staff as well. So this is specifically as far as dental clinics is concerned. It has also added here that emergency contact numbers should be displayed for the benefit of patients to address queries over the phone. So be available for patient queries over the phone, but dental treatments, not an emergency, should be shut right now. Our correspondent Neha Hebale has been getting us further details here on this. And Neha, this is for, of course, all dental clinics across the state, acknowledging that dental treatments, dental requirements, not an emergency, they can be shut for now.
Well, Sir, that's absolutely correct. You know, the IDA or the Indian Dental Association, as well as the Karnataka State Dental Council, you know, also have now put out advisories for dentists and for dental clinics to, you know, try and defer all treatments that are not, you know, emergencies for the moment, simply because at the end of the day, you know, we're seeing how doctors are the ones who are, you know, the most vulnerable. They are the ones at high risk. And especially why, you know, this is specific to dentists is because do understand that, you know, owing to the treatment, the kind of treatment, you know, that they're giving out, they become very vulnerable to it because of, you know, the spread of germs. I have with me right now, you know, joining us is in fact Dr. Ramamurthy. Sir, I'd like to first of all, you know, ask you, you're also a member of the IDA, you know, of the Central Council of the IDA. So what exactly is this order and how is it going to, you know, impact dental clinics in Karnataka?
We received the order from the Indian Dental Association head office from Mumbai, as well as the Dental Council of India. We received a circular saying that we should avoid the dental treatment and surgical procedures to further, because we, the dentists, very closely attached to the patient during any procedures. It's a high chance to risk as well as the dentist to the patient and who is surroundingly associated with our treatment aspects. So what we have to do ourselves, you know, we have to protect ourselves to the patient as well as to the dentists also. We have to you know, obey the orders from the government of Karnataka as well as central government and Dental Council of India, and as well as Indian Dental Association circulars we received. So what we, you know, we postponed all our procedures to the further indefinitely.
Sir, I'd like to ask you, so, you know, when we are saying that emergency cases only will be treated, what classifies as an emergency case? How will this be decided by the doctor, by the patient, or on a you know, mutual understanding? How what classifies as you know, an emergency?
Yes. Emergency in the sense, when patients comes to with the pain, severe pain, we can treat pain by taking the measures, protective measures, as well as we need to take the history from the patient. How long he's staying here? He traveled anymore from the different states of the, you know, different states of our country, or he traveled from the abroad? All that we need to take. If you travel from the other country, we need to take different measures. We are referred to the isolation centers, to the government setup. You know, those tests are done only from the government hospitals. In a few places, you also know that. But we need to treat the only pain by taking the precautionary measures and just treat the pain as emergency. We refer and we'll postpone the further regular treatments.
Okay,
Maybe
sir, so this is a government advisory that has been sent. The Karnataka government has sent an advisory, or is that yet to be, you know, done? Because when we spoke to the medical education minister, he said that, you know, orally they have been advised. So is there like an order yet, or is that still awaited right now?
We have not received any official order from the government. We received letters from the Dental Council of India and Indian Dental Association, as well as we received the letter from the Rahul Gandhi University of Health Sciences, saying that even we are working in the dental colleges also. We stopped doing procedures. We given the holidays to the students as well as. But in colleges also, we taken care only to treat the emergency cases based on OPDs. Few only selected doctors by taking the protective measures, history of the patient, and we treating only few cases. And procedures we are postponing it for the further.
Thank you, sir. Thank you.
Thank you very much.
So, sir, you know, of course, there you have it. To quickly summarize and for clarity, what we're understanding is that the government of Karnataka is yet to issue, you know, official orders on paper, but all dental clinics and dentists across, you know, Karnataka have been issued an advisory by the Indian Dental Association, and precautionary measures will in fact be taken. So, for more clarity, it is only the emergency cases that cannot be deferred at any cost that will be treated in dental clinics across Karnataka.
Okay. All right, so there's a clarification there. Of course, dental emergency cases that cannot be stopped midway, they would be treated, but otherwise it's a case of all dental clinics here being shut. Please stay on with us, Neha. This is with respect to what we'd seen at the Karnataka State Assembly. This was the condition of Vidhan Sauda here, where questions were being asked on why not enough measures were being taken as far as thermal screening or sanitization of the area is concerned. Neha Hebale had reported and asked those questions yesterday. As a mirror now impact This is a process which is only today being followed. So what you're looking at is thermal screening of people, of workers, of officials, which is now started, social distancing, the area being sanitized as well. But this was the basics that was expected from a state government, which had made all of these announcements, but not practicing the same at their own place of work, at the State Assembly. Neha, this is an important development here because it's important. It's important that our political leadership not just make these guidelines and announcements, but also practice what they preach.
Well, Sahil, that's absolutely correct. It was really startling yesterday when we were at the Vidhan Sauda. What we really saw, basic measures that were not put in place in terms of sanitizers, masks, or any other basic precautions that were supposed to be taken, keeping in mind the fact that, the State Assembly would see, a large number of MLAs attending as well. It was, in fact, after we, did a ground check, a ground report, and questioned the Medical Education Minister, Dr. K. Sudhakar, about the same, that today we see the State Assembly being sanitized, all the chairs, all the tables, and all the other buildings and walls as well, that the State Assembly comprises of, have been sanitized. Apart from that, you have sanitizers being, used at every entrance also. And even now, the employees that work outside of the Assembly as well in the same building have been urged to wear masks and to, ensure that their personal hygiene is priority.
Neha, many thanks for getting us those details and a positive impact here at the Vidhan Sauda. Four passengers who were asked to be home quarantined for 14 days have been caught at the Palghar station in Maharashtra. This is hugely irresponsible behavior, and this is how they were caught. In stringent measures that have been taken by the Maharashtra government, that if you're on 14 days quarantine, you will be stamped on the top of your palm and to remain at home quarantine for 14 days. They were flouting that, and then they were caught. Those four people there deboarded from Garib Rath, which is at Palghar station, when the co-passengers raised the alarm on noticing the stamp on their hands. These people are said to have a travel history of Germany. They were headed to Surat. After being caught, they have now been handed over to the district medical authorities. Our correspondent Neha Kulkarni is getting us further inputs here. Neha, this is of course a very, very irresponsible, annoying behavior. But thanks to the measures taken by the Maharashtra government in identifying those who are home quarantined, and this is exactly how that stamp has helped today.
Absolutely, sir. We must say the stamp has come to use, but it must be seen how it worked out, because these four passengers were home quarantined. They took this train, Garib Rath, to go till Surat, and in between at Palghar, the four passengers and railway officials saw that they were having the stamp on their hand, and after seeing that stamp, they alerted the authorities about them being home quarantined. They were sent by private transport to Surat. But it is important to notice here that how this the stamping of a 14 days period of wherein they are not supposed to use the public transport, they are supposed to keep themselves isolated, is not being taken seriously. And it is important that these people who are home quarantine take this seriously, keep themselves in isolation so that they do not put others' life at risk.
Yes. Neha, when this was announced, this measure, it was also said that a violation of this is going to be acted upon strictly. Is there any action that they're facing here on this?
Till now, these two people have been sent by private transport. The Palghar district authorities arranged for that, and they were sent off to Surat. The message has been given to the government authorities about them being deported at Palghar. Till now, no action has been taken upon them, but in fact after that the railways disinfected the particular coach where these passengers were sitting, so that the other people who are traveling, they remain safe and they remain free of any kind of virus there.
Extremely irresponsible behavior by the four youngsters there, but luckily they were caught thanks to the home quarantine stamp in their hand. Neha, thank you for getting us those inputs. But this is a case of responsible youngsters who were only arrested for asking the right questions. 2 youth from Goa, they were arrested for questioning the Deputy Chief Minister for flouting the advisory on public gatherings and social distancing. They have now been granted bail. We have with us our correspondent Herman getting us those inputs here. Herman, there were of course people questioning this arrogant abuse of power by the Goa government. They have now fortunately been let out on bail.
Well, yes, in fact, this is a breaking news coming in at this point in time. The 2 members, youth belonging to Revolutionary Goans, who were arrested yesterday after having questioned the Goa Deputy Chief Minister about his irresponsibility and social distancing, have now been granted bail. The exact conditions of the bail that have been granted to them are yet to be known because this has just taken place just a few minutes ago, is what we've been told. But yes, currently they are out right now, but no justification whatsoever has come in from the Deputy Chief Minister or his office.
Right. Also because, Herman, the circumstance of this here, given the fact that the government, members of the government, this is the Chief Minister, the Deputy Chief Minister, are preparing for Zilla Panchayat elections, and they've brazened it out in justifying these public gatherings to the extent of arresting these 2 youngsters who questioned them about it. Is there any corrective measure that one can hope from the government, from the Chief Minister, from the Deputy Chief Minister?
Well, at least at this point in time, one wouldn't know exactly whether any sort of whether it will be delayed, because you have a circular that has come in from the State Election Commission giving various directives in view of coronavirus and about the polling day. So therefore, it is unlikely that it could be postponed. But yes, after having, when the media did report about the Goa Chief Minister Pramod Sawant himself flouting norms, we saw that, there was a repeat sort of similar action, but something far more bizarre, where the ones who questioned the Goa Deputy Chief Minister also ended up getting arrested. So clearly a pattern that has been emerging from the Chief Minister to the Deputy Chief Minister. Hence, it looks unlikely that either the polls are deferred or any sort of justifications that can come in from the Chief Minister or the Deputy Chief Minister.
Talking in this time of a coronavirus crisis here, you have our political leadership brazening it out in this arrogant manner. Herman, thank you for getting us those details. In the state of Punjab, this is regarding close to 167 people who are suspected of coronavirus are missing in Ludhiana, out of which only 29 have been traced. The Public Health Department has received a list of people who recently returned to India. They've now been backtracking on to ascertain the infections, but this has proven to be a difficult task. Either a wrong address in the passport or an old telephone number, which is making this difficult. 2 teams have been tasked now to find people coming from abroad, which the police have been given responsibility for finding. On the list now, 119.
119 की लिस्ट दी थी, उनमें से 12 ट्रेस आउट हो गए हैं, तो वो इस काम में लगे हुए हैं. कुछ हमारे डिपार्टमेंट के आदमी हैं, 77 की लिस्ट इनके पास थी, वो भी लगे हुए हैं. उन्होंने कल मैं 17 को ट्रेस आउट कर लिया था, और जैसे जैसे वो ट्रेस होते जाएंगे उनको हम हेल्थ एजुकेशन देते रहेंगे.
In Uttar Pradesh, the Ayodhya administration is yet to cancel the Ram Navmi Mela. Remember, this is where pilgrims in lakhs are expected to come in. A large number of people who have already reached Ayodhya for the annual festival, which is scheduled to be held between 25th of March up to the 2nd of April. But this is despite the government, the state government's own advisories and the central government's advisories to avoid large religious gatherings in the wake of the outbreak of coronavirus. In fact, the UP Chief Minister Yogi Adityanath, who is also scheduled to attend this festival, this year's celebration, which is considered extra significant because it has come in after the Ayodhya judgment. Earlier on Tuesday, the Chief Minister Adityanath there issued an appeal to all religious gurus to prevent large gatherings in temples, mosques and other religious places. But the state government ordering the closure of all tourist places and museums as well till the 31st of March.
मेरे ख्याल से यहाँ कोरोना का कोई वो नहीं है. सब अपने काम में दर्शन भी, जो दर्शनार्थी भी हैं, कोई कमी नहीं आई है. और जो कोरोना का है, जो बम्बई और वहाँ जो इंटरनेशनल एयरपोर्ट है, वहीं तक सीमित है. मेरे ख्याल से यहाँ कोरोना
तो लोग कर रहे हैं, सैनिटाइजर का यूज कर रहे हैं, जो बताया गया है लोगों को वो कर रहे हैं।
दर्शन में कोई कमी
नहीं, कोई नहीं, जैसी थी वैसे ही चल रही है।
कहना यही है कि सब काफ़ी ज़्यादा भय है लोगों में कोरोना को लेकर, लेकिन हम ये देख रहे हैं कि आस्था को लेकर कोरोना के लिए कोई भय नहीं है। यहाँ हम दर्शन करने आए हैं, सरजू नदी के किनारे हम देख रहे हैं कि काफ़ी संख्या में सैलाब उमड़ा हुआ है, और हनुमानगढ़ी पे जब दर्शन करने यहाँ हम आए तो देख रहे हैं कि काफ़ी संख्या में लोग श्रद्धालु उस भय को छोड़कर भक्ति भाव और श्रद्धा भाव के लिए हनुमान जी के दर्शन कर रहे हैं, और भक्ति के लिए लोग, कोरोना के लिए कोई भय नहीं है।
And this is also regarding examination season. While several exams across schools and colleges have been cancelled or rescheduled, the CBSE, of course, has to go ahead as per schedule. These are new guidelines that have been put in place. Our correspondent Neha has gotten us some reaction responses from both parents and students from Mumbai.
We must say that as far as Maharashtra is concerned, even SSC exams are still pending, apart from the CBSE and ICSE board, both for 10th and 12th. And with the continuous pressure with the social distancing measures, of the other guidelines increasing, differing every day, it becomes difficult for parents and even students to cope up as to what has to be and has not got to be done, because they have to go to the centers, they have to be ensured that they are sanitized always, and they give exams. Let me put across all these questions to some parents who are joining me here. Their children are appearing for 10th exams for ICSE board. Ma'am, it must be a difficult time for you all right now, but the fact that you have to do both the jobs, ensure that your parents, your children, students are healthy, as well as they are not being, their concentration is not getting affected due to all the guidelines in place. How are you managing it?
It is really difficult to manage things because so much is going on in the air, in the mobile, on that screen, everywhere. So these guys are managing, and we are just keeping our fingers crossed that exams shouldn't be postponed, shouldn't get postponed. Because in case if it gets already the ICSE 10th, almost 33 days the exams are going on. Now again, if it will get delayed, it's going to be really harmful for them. And these guys will get frustrated.
Do you agree the exam shouldn't get postponed, considering the time is really tough, and the students also have to be ensured about the new guidelines in place against the virus scare?
Yeah, obviously, even I feel the exam shouldn't be postponed. Even the kids are taking the proper sanitization methods. They're using the sanitizers. Even the schools have assured us that they are going to sanitize the area and everything. They are allowing the kids to use the mask as well as the sanitizers. So I don't think there should be any issues. And secondly, all the centers are nearby for all the students, so I don't think they would need to travel by bus or train. They can even travel by private vehicles. So even in that way, I don't think that the exam should be postponed.
The exam center, is it anything different at the exam center when all these measures are being taken?
We are told to carry sanitizers, and we are told to wear masks if we have. We are also given sanitizers to sanitize ourselves.
So don't postpone the exams, is what you're saying?
Yeah, they shouldn't do that. We're not ready to go through it again. It's a very big thing and a crucial year. We're not wanting to delay our exams anymore and go to the same special. I think with proper precautions, the situation can be handled. It doesn't have to get affected.
Okay.
Those are the immediate concerns of young students. Of course, don't want another rescheduling of those crucial exams. And here's how students and parents in Delhi have reacted as well. Our correspondent Alok with those voices.
Amid the threat of coronavirus, examination is going on various centers. Today is class 10th exam, board exam is going on at this Kendriya Vidyalaya here. Social science exam, that is paper, in fact, the students are taking. Today is the last day, but during the time of coronavirus threat, definitely there is a threat among the students as well. And that is why the precautionary measures are being taken. The government has also advised to take the precautionary measures. Students are allowed to take the mask and sanitizer with them. Today, what we are getting to know from the teachers as well, that they have set the table and chair 1 meter away from each other. Earlier, there were arrangement of around 24 children in one class, but today the arrangement of 12 children in one class. So the school is also taking precautionary measures. I'm being joined by some of the teachers. In fact, ma'am, in the time of coronavirus and all these threats, क्या precautionary measures that आप लोग ले रहे हैं?
Like all the students are, most of them are wearing the mask, and even the CBSE has made the arrangement, sitting arrangement, that they should not sit close to each other, at least 1 meter apart.
Okay.
So this practice started yesterday only.
Okay.
So the students are aware of this and they are taking the precautionary measures, and we too have informed them.
Okay.
This is
मैम एक अच्छी चीज़ ये है कि आज लास्ट डे है क्लास 10th के बच्चों का, लेकिन 12th के बच्चों का यानी कि आप लोगों को अभी भी आना पड़ेगा।
हाँ, नहीं हम आएंगे, बच्चों को बेस्ट ऑफ लक करने आएंगे और उनको प्रिकॉशंस फिर देंगे टाइम टू टाइम कोरोना वायरस के लिए, वो कैसे दे कैन टेक केयर ऑफ देम एंड द अदर पीपल आल्सो। आई विल।
अभी मैम एग्जाम चल रहे हैं तो बीच बीच में आप लोग बच्चों को क्या इंस्ट्रक्शन देते रहते हैं? कहीं से एग्जाम के दौरान में कहीं आप लोगों को कुछ प्रॉब्लम फेस करना पड़ता है?
सच देयर इज नो प्रॉब्लम, वी टेल देम टू कीप वॉशिंग देयर हैंड्स टाइम टू टाइम and do the sanitizer and keep their mouth covered with mask, etc.
Adequate measures, safety precautions that are being taken for crucial exams. One of them, of course, being the last day today. With that, it is a wrap on the big story, but stay on with us. Coronavirus news and updates that continue for you through the day.